views and opinions expressed in this program are those of the participants and do not necessarily reflect the views of BronxNet or the program underwriters.
Welcome to Bronx Connections, the Digital Divide. I'm Nora Thomas.
And I'm Eliot Schiaparelli.
We're reporters for WFUV, an NPR affiliate station based on the Rose Hill campus of Fordham University in the Bronx. Bronx Connections is a joint initiative between BronxNet TV, WFUV News, and Norwood News. In this episode, we're looking at how healthcare and social services have adapted during the pandemic to continue to safely provide their essential work.
Over the past year, community organizations have supported those in need. Some had to transition existing programs, and others had to create entirely new ones. In this episode, we wanted to look at some of these programs that have sustained entire neighborhoods over the past year. We talked to the community leaders about what they've seen and learned and how it'll inform their work going forward. Nora, you talked to a doctor about telehealth.
I did. Dr. Rebecca Capasso is the Medical Director of Psychiatry at Project Renewal, a nonprofit that works to provide housing and health services for New Yorkers experiencing homelessness and mental health or substance abuse difficulties. She said the pandemic pushed Project Renewal to adopt a telehealth system that's been a really big success. Rebecca, thank you so much for joining me. Can you give an introduction of yourself and Project Renewal?
Yeah, sure. So I'm Dr. Rebecca Capasso. I'm the Medical Director of Psychiatry at Project Renewal. What Project Renewal is a fantastic social service organization. We're a not-for-profit, which was really launched because we wanted to address homelessness, drug use, and mental health in our clients. So we are a organization that deals with a person's whole self as far as their health goes. We also deal with housing, which is really primary for what people need, and also jobs. So we cover both of those, all three of those departments, so that people can really reclaim their lives after experiencing homelessness for whatever reason that they might have experienced it. So we have various mental health shelters, substance use shelters that we run as an organization. We have transitional housing then coming out of the shelter system, and then we also run permanent housing locations. All of our transitional permanent housing, the shelters that we run in the Bronx and throughout all of the different boroughs, except Staten Island, we're not there yet, are for folks, again, primarily with serious mental illnesses or drug use or health, substance use disorders. And so what I do as well is work with, of course, the health end of the spectrum and delivering psychiatric care to all of our folks in our system.
So on the medical side, on the healthcare side, what did your guys' services look like before the pandemic?
So we have about 18 or 20 psychiatric providers at any time, and we really put them embedded in the shelter system so that you would be able to get care exactly where you lived. We really believe in having absolutely no barriers to care whatsoever. So we wanted them to be right there where the person lives so that there wasn't, travel difficulty, travel costs to get to your healthcare provider. So we had a psychiatry provider, either a psychiatrist or a psychiatric nurse practitioner embedded in our shelters and embedded in all of our transitional and permanent housing, had the ability to have a psychiatric provider on hand. We also have psychiatric providers in all of our, we have a detox that we run, a rehab, drug rehab facilities, and we have psychiatric services for all of those clients as well. We have an outpatient MICA treatment program, which is mental illness and chemical dependence. And again, we have a psychiatrist stationed there as well. So I'm really in charge of all of those folks embedded in the areas that our clients actually live.
That sounds like a really robust, diversified approach. How have things changed with the pandemic?
Yeah, so then the pandemic happened and we were all scared and nervous and didn't know what to do. Guidance was coming out so slowly, it felt like. and basically what we knew is that we had to keep delivering care, that it was absolutely essential that during this crisis, during this global mental health crisis on top of a global pandemic, that we continue delivering support and mental health care. Again, most of our clients have serious mental illness or drug use problems, and they were also being advised, the public in general was being advised to not seek medical care unless it was essential. And that almost put it on the person to decide, well, is my healthcare essential right now? Should I be going to the doctor's office? And I think a lot of people just said, well, I'm going to isolate. I'm going to keep my distance the way I've been told. And so I'm not going to seek my usual care. And that could be a huge problem. So we really wanted to figure out how we could continue delivering psychiatric care, mental health care, drug overdose prevention, all of those things that we were doing normally to our folks. And now again, we were a little lucky because we're embedded. We're at the place where our folks live. So again, they didn't have to go and get on the subway and travel to some outside clinic to see the doctor. They could just be there. But our clinics, while lovely, are a little small. And so then we were thinking about other things like infection control in our clinics. If someone was coming in and sitting definitely less than 6 feet away from the doctor, what were we going to do? And as a psychiatrist, covering this much of your face really takes away sometimes how you could relate. And so it got scary, and we were trying to figure out again, how do we deliver this care to folks in the middle of the pandemic when even they're being encouraged not to go unless it's essential.
What are some specific changes you've administrated?
So what we ended up deciding was that we were going to completely roll out telehealth or telepsychiatry throughout our system. So in the first, I would say 2 weeks of the New York City pause that went into effect, we decided we were going to have to utilize telehealth. It was the only way we were going to be able to reach out to people, to continue delivering our essential health care to those in need, while protecting them from the infection risk of coming, into a clinic kind of thing. And so this was really successful. It went really well. We did worry at first, how would people respond to suddenly seeing their psychiatric provider on a screen? And, how are they going to interact with the screen? And they loved it. People absolutely loved being able to see us so conveniently. So we were able to purchase and install telehealth stations. It basically looks like an iPad. So essentially, it's a touch screen with only like our telehealth platform on it, and people could basically just click, enter their name, and get connected with their psychiatry provider. So they could either come into the clinic just like they always had, or come to the room where the provider was normally sitting. That was an option if that's what they wanted. But if they didn't want that, they could connect remotely on the screen. And we made sure the screens were embedded where, again, the people were living, so that they didn't have to go somewhere, use the subway or whatever, use mass transportation. And regulations loosened up so that we could use basically any smartphone. So if our clients had a smartphone with internet and a camera, we could conduct their sessions in their room. And clients really liked that option. Again, no long prep to get ready to get to go see your doctor. You could just click the button and talk to your doctor.
Well, thank you so much for your time. Take care, and I hope things continue to be accessible and impactful for your clients.
Same to you. Thanks for taking the time to talk today.
That was Dr. Rebecca Capasso from Project Renewal.
Thanks, Nora. I really appreciated hearing about how they've managed to keep up with all of this increased need. I talked to Julie Spitzer. She's a department director at BronxWorks, and she's also been involved with a lot of homeless outreach programs, like Dr. Capasso. We talked about how her job has changed and become more hands-on over the past year. She and other department directors have started working directly with clients in their food pantries. I thought that was important considering how many of us have become a lot less hands-on over the past year. Here's Julie. Julie, tell me about yourself and what your role at BronxWorks is.
I'm Julie Spitzer. I'm a department director at BronxWorks, and my role is to wear many hats. So I oversee some of our homelessness prevention programs, helping people with rent arrears. I've been overseeing our pantry, food pantry, and a lot of our walk-in information and referral services that's provided. Some of our senior eviction prevention programs, things like that.
What does a typical day look like for you, or is there a typical day?
Typical pre-COVID or typical now? I mean,
so let's start now, and then you can tell me how it changed from before.
well, now, I mean, many people here are wearing several different hats, and we've had to roll up our sleeves. During when the height of the pandemic happened, we used to run a pantry. We had staff, we had volunteers, slowly those things went away because of the pantry. I mean, because of the pandemic. So many of our senior managers had to step in and start operating the pantry because we couldn't shut that down. We had to continue. We knew that had to continue. So we had some staffing, but very little volunteers in the beginning. Even our executive director was working the pantry on Saturdays, which is amazing for me to see. And it actually gave a lot of the staff motivation. It gave community members a lot of motivation to come in when we were able to say, this is our executive director and she's working at a pantry. A lot of our senior staff were there working the pantry, helping to serve the community because the need was so great at the time. What's my role is everything now. There's nothing off the table right now. So yeah.
So when you're in the food pantry, that's probably some of the most direct contact you have with Bronx residents. What are you hearing from them about the resources they've needed over the past year?
Well, let me just say this. Previous to pantry, it was, our offices were open, easily accessible, things like that. People knew where to go. People were working. People had benefits. They had their stuff. After the pandemic happened, it was crazy. People's main priorities at that time was getting food, but they had other priorities. Many of the members of our community was really hard hit by unemployment. So some of them knew they've never been on benefits, never had services. It was, they're unemployed for the first time. So when they were coming to our pantry, what we saw is that people didn't have basic things like SNAP benefits, health insurance. Even though they qualified for unemployment, they didn't know how to access it. And then if they knew, it was hard for them to get through on the phone. It was hard for them to gather the documents. It was like they needed help. So we tried to implement with our pantry, coupled with our pantry, social services.
Mental health wise, being a senior and being in isolation of some sort for the past year, were your social workers able to keep in contact with them and help them out that way? Were the home delivered meals, did those help? What happened there?
Well, yeah, I mean, in some of our programs, we're embedded in seniors residential communities,
right.
Like they call them naturally occurring residential communities for seniors. We're embedded in those communities. So we've tried doing like Zoom activities with them. We've done, planting outside in the beginning of the COVID era where things could be done outside so that they don't feel completely isolated. We did gardens, and then we transitioned to what they call them, window gardens, so that they can do it on their own. We had projects where we helped them to get on the computer and do sip and paint type thing, but virtually sip and paint. So to help keep them active, we did stuff like that.
And speaking of seniors, I understand you guys assisted in vaccine delivery for seniors. Yes. What was that like?
So we did a lot of pop-up sites. We had a couple of pop-up sites where we administered vaccines. Well, not us personally, but
right. Facilitated.
Yeah, we facilitated that. So what we were doing, we were registering seniors to get that's on our intakes that we've done. We've taken the seniors, we've gone and picked up seniors from different locations as well. We use our vans to pick up seniors to bring them to vaccine sites. Yeah, that's basically what we did. Yeah.
And what response to that have you gotten from seniors and their families?
Oh my God, they were so happy. They were so happy because one, they weren't able to get through on the phone sometimes. They were having difficulties getting appointments. Even some seniors were a little apprehensive about doing it at first, but when they knew it, we were involved and we were going to do it, it helped because they know us, they know, and we were like, hey, we would get it too. We're going to do it. And they became a little bit less worried about it. So I think that helps to have the community organization that knows the client reaching out to them and saying, hey, let's do this. It's not just some doctor that's coming from somewhere they don't know.
Yeah.
Asking them to take a shot.
You guys are a part of the community that you help.
Yes, we're a part. I mean, I personally grew up in the community, so.
Yeah. Well, tell me a little bit more about your background and how you ended up at BronxNet. So you grew up in the Bronx?
I actually grew up a few blocks from my office. Went to the community school. Went to the junior high school in the back of my office. So I'm a staple in my community. I live there, and I've worked for BronxWorks for 29 years. So I've seen the children grow up that used to come to the youth programs, and they're like, hey, Miss Bella's there. You're still there. That's my maiden name. Like, you still there? And I'm like, yeah, I'm still there. Like, wow, it's been like 29 years or so, Wow. I'm like, yeah, I'm still there. It's a great place to work.
Is there anything else you want to add?
People don't realize how much social services mean until they need it. And the social services that we provide are extremely essential. The city people in our community could not have survived without the food pantries and the assistance from us that they needed to obtain benefits. So I think it's great to have a voice to be able to speak and let people know that my staff were crucial to helping people overcome this pandemic.
Do you think the pandemic will change the community's view regarding the importance of social services?
I certainly hope so. I think social service workers are not necessarily seen. We're always in the background. And right now we were put to the front to help because we couldn't shut down. When everybody else was working at home, we were there, we were working. I know a lot on the news, they focus on, like grocery workers and things like that. You rarely ever hear them talk about the pantry worker. You rarely hear them talk about the person who's helping people manage, like getting SNAP and health insurance. Those things are not mentioned. And those are essential because I don't think people could survive without those things. Our shelter workers, people who work in our shelters, those things are essential. We can't shut down. So I'm hoping this changes things and people see.
That was Julie Spitzer from BronxWorks. Nora, you spoke with one more guest, Lauren Mendenhall of the Acacia Network. What is that and what does she do?
Acacia is a human services network that works with over 100 affiliate organizations to provide a wide range of services. Lauren's the vice president of primary care and network quality improvement. She said that it was hard for a while to convince patients that it was safe to start receiving primary and preventative care again. Here's Lauren. Hi, Lauren. Thank you so much for joining us today. Could you tell me a little bit about the Acacia Network?
Yes. Well, first and foremost, thank you so much for this opportunity. Yes, the Acacia, so I'm Lauren Mendenhall, Vice President of Primary Care and Quality Improvement for Acacia. The Acacia Network is one of the leading social service organizations in New York City and the largest Hispanic-led nonprofit in the state. It's this really intricate, integrated, culturally competent web of affiliates. So we have over 100 affiliates, and we provide a full gamut of services from primary care mental health and addiction services, residential treatment, affordable and supportive housing, transitional housing. If you think of the Maslow hierarchy of needs, this really is addressing that base value. What is it that we need to be productive citizens? So again, Acacia is just this really holistic, integrated network of services.
What did the sort of health-oriented services look like before the pandemic started?
Great question. So part of what Acacia, one of the programs that Acacia runs is called a federally qualified health center. So federally qualified health centers have been around for over 55 years. The whole premise is that we provide services to the underserved. So, and it's not urgent care, it's not hospitals. It's really about preventative and primary care services. So before the pandemic, it was just that it's this one-stop shop primary care services. We provide dental, optometry, specialty services, integrated mental health services. So before the pandemic, it was just that you come in, we provide comprehensive services and ensure that, we're really trying to address all the preventative measures that we possibly can to ensure that you're healthy. Post-pandemic, it was an incredibly disruptive, tragic year for everyone, including healthcare. You can see, I'm sure, we've all read the studies that healthcare, there's a lot of deferred care. So like I just said, we're really focusing on preventative services. A lot of patients weren't coming in at that point. The executive order was placed. There was a strong encouragement that if you don't need immediate care, if you don't have urgent needs, please stay home. So a lot of patients, a lot of us heeded that warning. And as a result, a lot of patients weren't coming in for their services. So you could see across the board, the hospital utilization went down, healthcare utilization went down. So I know I'm getting ahead of here, the questions, but one thing that we all had to do was pivot on a dime and ensure that we could provide healthcare in a different modality. If you can't come into our doors, we need to figure out how to come to you. So telehealth, we were practicing telehealth, maybe 1% or so telehealth, televisit or telephonic visits. Thereafter, it immediately became, 25 to 40% of our visits were conducted in that telehealth fashion. So what did it look like before and what did it look like after? We still provided those same services, but just in a very different fashion.
Since that executive order, has it been hard to convince clients to come back and get like the basic care that was deemed last spring non-urgent that they still need?
Initially it was. Again, there's a lot of hesitancy, and rightfully so. People were scared, especially in the Bronx. I read one report that showed that Bronx residents were dying at a rate twice as high as those in Manhattan. So the Bronx was devastated by this, just as so many else were. And because of that, it was really difficult to bring them back in. So there's a lot of proactive outreach. As I'm sure you've seen, there are particular risk factors that would set you at a higher risk for COVID than others. So we created a proactive list. We created a list that showed those patients who were at higher risk. We reached out, not necessarily to come in, but just to check in, to see if you were okay, if you needed any services. Obviously, if you're socially isolated, you have a higher propensity for depression and anxiety. So there's a lot of behavioral health screenings that were going on. So there's a lot of proactive approach, a lot of education to try and just let patients know that you don't have to come in unless you need to, but there are other ways in which you can reach us. And then reactively, there's, New York City has a very intricate system in which if you are a patient of a primary care center and you are admitted to a hospital, provided that the patient's given you consent, we will know immediately when you hit that hospital. So a lot of our patients, as soon as they were discharged from the ER inpatient setting, we were able to immediately follow up and say, hey, we saw that you had COVID, or we saw that you're going through something. We just want to check in. If we can set up that follow-up care with us again, either in person or telehealth, we really try to be reactive and proactive at the same time.
Well, I'm really glad that there's that network. That seems like that's probably really impactful for ensuring clients' health. Have you received positive feedback for the changes you've made?
Yeah, we have. We have patient satisfaction surveys, just as a lot of health centers do, and patients were very grateful to have these options. Again, we're just trying to mitigate the risk, trying to ensure that there's continuity of care regardless of where you are located, what you're going through. So the fact that we can now give patients these different options to continue their healthcare in a different fashion, they were really grateful. I'd also say, prior to COVID, we weren't exercising, we weren't really utilizing telehealth, telephonic, but we also didn't have an online portal in which you could request services or ask questions. Since then, again, this has been such a disruptive pandemic for so many reasons, but there's also been some positives. So now we do have an online portal in which you can request appointments, ask questions of us. And so again, we're really just trying to reduce the barriers for patients to access us.
Is there anything further that, maybe someone who isn't super familiar with Acacia or, the health care industry in general is there anything you think they should know about the industry at large and Acacia in particular in the wake of the pandemic?
I will say, again, we were talking about the federally qualified health centers. This is an incredible network of institutions across the country. So the whole point is to ensure that we are serving the underserved. So if you are undocumented, if you are uninsured, you have insurance, but perhaps you're uninsured or you're underinsured, and perhaps you have a really high premium, we provide services, clinical and primary care services, regardless of your ability to pay, regardless of your documentation, your immigration status. And again, that's just one foothold into this much broader Acacia spectrum. So I think, again, if there's a hesitation about who you are or what kind of documentation you bring, the whole idea and the whole mission behind Acacia is to ensure that we're reducing inequities. And so if you have a need, maybe you don't have a need, but maybe your neighbor or family member, if there's some sort of clinical or supportive need that you have and you're not sure where to go, please do reach out, acacianetwork.org. I can't even begin to talk about all the different services that we provide, but it really is, if you think about this cloak or this really integrated, interwoven network that really just cloaks our patients, that's exactly what Acacia is. So if there's ever any questions about, what we can provide, acacianetwork.org.
Thank you again. So wonderful that organizations like Acacia exist and are serving the Bronx. Thank you for your time and take care.
Thank you. And thank you for all the coverage that you're providing for this. This is wonderful.
That was Lauren Mendenhall from the Acacia Network. Special thank you to Dr. Rebecca Capasso, Julie Spitzer, and Lauren Mendenhall for joining us. Thanks also to Sheila Maloney from Norwood News, Louis Rebolledo, and Michael Maxnabi, and everyone else at BronxNet, and to George Podarki and Robin Shannon at WFUV.
Finally, thanks to Rosie Sweeney and Noah Osborne. They'll be taking over the show starting in a few weeks. To read, watch, and listen to more from Bronx Connections, go to norwoodnews.org, WFUV.org, or bronxnet.org. I'm Eliot Schiaparelli.
I'm Nora Thomas. Thanks for tuning in.